and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to go over the absolute best exercise for pinched nerve pain. It's a Mckenzie technique.
Right.
And it's updated. We did this video before. We're going to do it better because the sound was terrible on the old one.
Right. We got it arranged a little bit better. I think it's easier to follow, and there's going to be some really good results with this, isn't it?
Yeah. What's amazing about this is if you follow this, 80% of the people that do this tend to get decent, really good progress if done right.
Yeah, there was a study on this.
There was a study that showed that 80% of the people got good results from this.
So we're going to get right into it. But before that,
if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you want to go over to bobandbrad.com. We're always giving something away. Right now, we're giving away. Do you want to show Booyah Stiks?
Yeah.
We're giving away a couple Booyah Stiks. Boy, you know, you can. I don't know how you can live your life without a Booyah Stick.
Oh yeah, we use it for stretches,
posture, shoulders.
Absolutely.
You can also find it on Bob and Brad at Facebook. It'll be pinned to the top of the page. Go to Twitter or Instagram if you want a shorter version of our program.
There you go.
60 seconds.
Sounds like you said that before, Bob.
Yep, a couple times.
Yep. All right. So let's talk about this. We talked about Mckenzie. Now, Robin Mckenzie, well-known therapist worldwide. He's not alive anymore, but he started a whole system, and we've both taken all of his classes.
34 to 36 countries, 38. But this is his book, Treat Your Own Neck. I would highly recommend it because it's written for the layperson.
Right.
And it'll go over everything we talked about today and additional stuff.
Right. And then we show our own little tricks that'll be helpful.
These are like $10.
Yeah, they're quite
really
reasonable.
Really
call it cheap. Okay.
All right.
Let's go on, Bob.
Oh, you want to show referral patterns, right?
Yes, we do. Now, when we're talking about a pinched nerve in the neck, oftentimes the pain that you feel is not in the neck. But why don't you get up and we'll show. We have patients come in a lot. Now, Bob has yellow tape. This isn't anything that his wife put on this morning to make him look silly without him knowing about it.
I do that well enough on my own.
Right. So the pain origin is here, but oftentimes the pain refers into the shoulder blade, in the shoulder here. Oftentimes, if that nerve is pinched, because the nerve actually runs right down the arm, you'll feel pain, numbness, tingling, all those symptoms on these yellow tracks right into the hand. So what we're doing with the system that we're going to show you, we're going to treat the neck. And the first thing you want to have, if you do have pain or symptoms down the arm, is that they start to get relieved or be abolished, go away from the hand up to the elbow first. So if we do the exercises and the pain here goes away, but it still hurts up here, the patient saying, well, this feels better, but it still hurts here. That's a good thing.
It is. And this could be your starting point too. Maybe it doesn't go down as far.
Right.
Maybe it only starts here.
Yep.
In this case, you want this section to start getting better first.
Right. So if you continue the exercises we're going to show you and the pain goes away there and it's just here, that's called centralization. We're getting the pain to centralize up to the starting point. And then we finally get rid of this by doing the proper exercises. And then once the pain is centralized to here, you're gold. You know, things are looking really good for a complete
And sometimes it's real subtle. You can't tell it's getting better. Like you might have tingling in your hand, and the tingling goes away.
Right.
Good sign.
Exactly.
Any of the symptoms, we want them to get improved.
Those pinched nerves, you know,
it's bad pain.
Right.
That's about some of the worst pain you're going to get. Is
it gnaws at your life.
Right.
So the first thing that you really need to address is posture.
Yes.
So in other words,
because if you do these exercises and you're not correcting your posture, it's just going to it's going to stay there.
Right, exactly. So, you know, particularly if you have a job that's seated or car driving a lot throughout the day, you may not be aware of head forward slouch posture. A lot of times you have to look in the mirror or have someone else say, boy, you know,
Yeah, your posture's bad.
Your wife did that too, right?
Yeah, she did. Yeah. She was pointing it out at my desk, and she took great pleasure in it, by the way, too.
Yes, well,
so
it helped you out, though, didn't it?
It did help me, yes.
So first thing we're going to do, shoulders back, head up, and chuck that chin in. And
it helps to even do some shoulder squeezes throughout the day to make sure you're lined up correctly.
Right.
You know, the ears should try to be almost lined up along with the shoulder if you do a straight line down.
Exactly. Now, this isn't the exercise or one of the exercises, but you have to be in good posture to execute them and then maintain that throughout the day. The first exercise we're going to show are chin tucks.
Right.
We talk about these all the time.
All the time.
But I'll have
Ad
people
nauseam.
with pain here, and I'll say, can you do a chin tuck? And they'll do that, and it usually is uncomfortable. It'll hurt. And if they'll say it hurts more here than over here, that's pretty much a good sign. If you do 5 of them and things aren't getting better each time, then we need to stop that and then go on to the next step.
Oh, try a supine, you mean?
Well, we can do that too, yep. So if that's not working, lay down. Now, you could lay in your bed, but this is much better on a carpeted or a firmer surface. Not hard, but firm with a cushion like a carpet.
And it sometimes helps to have a towel there, Brad, to do, you know, like that. And now it's easier for me to do the chin tuck.
Right.
I'm trying to, again, I'm not bending down. I'm not bending up like this. I'm just bringing my neck back like this. And sometimes if people's necks are really sensitive and really painful, this is the way to start.
Yeah. I always say, if you can lay like this and try and touch the back of your neck to the floor, that'll give you the proper motion.
You probably won't be able to, but that's what you want to think about.
Exactly. Now, I've had people just with this exercise take care of a good part of the problem, although not usually.
Right.
But it's still, sometimes I have to jump to step number 2 here. And this is, you want to sit in your chair?
Yep, I shall do that.
Here, I'll give you your towel. We're going to do extension.
And we're going to do it different ways here.
Right.
But
now, typically, people who have a pinched nerve in their neck, if I ask them, can you look up toward the ceiling, they'll start and get about here. Oh, it hurts, and it's not comfortable. Sometimes it gets worse down the arm. And then, you know the problems from the neck.
Yeah, we're trying to always make the pain better. We're not.
Right.
It's not something it'll get better through working through it.
Right.
You have to eliminate it.
Right. So what we're trying to do eventually is get this normal range of motion back. And when you get this back, chances are you're going to have the problem solved by then.
That's where the magic happens, they say, is when you start getting the neck fully extended. Now, Brad, do you mind if I just jump in? I mean, you can start off with just doing short arcs like this. But eventually, at some point, if that's not working, then you're going to go to a towel.
Yeah. And I find
the towel
majority of the time, people are much more comfortable. Roll up a towel. We got 2 different methods. I'll show you this way first. Especially if it's bad, I'll start with a nice cushiony towel roll, and I'll have the person lean back into the chair. Office chair works really nice, but the chair cannot be a high one. It has to be low at the shoulder blades or lower, so that you can lean back into it. And then you just bump back into the tightness or the pain. Don't push it, and you can do 10 repetitions maximum to start with. And hopefully by the 10th one, it loosens up and you can go back farther and less pain.
And when you do these, you can actually do them throughout the day.
Right.
We recommend like 5 to 8 times.
Yep.
I mean, like every hour. And you know, if you say, well, I don't have time for that, well, then you have time for pain because your pain is going to continue.
Right. Again, after a few repetitions, it loosens up. Get more range of motion, the pain centralizing. You really need to get after it, like Bob said, 5 to 8 times a day.
Brad, what I tell people sometimes too, let's say Brad has pain down his right arm.
Yep.
I'll have him grab it just with the left arm. Grab the towels. Just
I thought you wanted to shake my
No.
Oh, like this.
Yeah, like that. Just because the arm is sore, I don't want him pulling down on it. You know what I mean?
Exactly.
So this is a little different one. To be honest with you, Brad, I've been using yours more often now lately. But this one, you can kind of get different levels of the neck easier.
Yes.
You're using the salvage.
Salvage
or salvage?
Someone will comment and correct us.
The
edge of the towel.
The edge of the towel. And by pulling back like this, and I usually pull up to my eyes.
Yeah.
I'm not pulling down like this. I'm pulling up to my eyes. And then I try to go back like this. Again, the advantage of this one, you can hit different levels of the neck, and sometimes that feels better then.
I'll have patients start at lower, higher, and I said go down about 1 inch each time, and you'll notice when you hit the right spot, all of a sudden, oh, you can go back farther with less pain, and then you know you got the magic.
Absolutely. And generally, I'd like a longer towel because I'd even do it with one hand too.
Yeah, that towel is
just
short.
a little bit short.
Yeah,
so
yeah, we've got an issue with big towels here. But
yeah, they don't have. That's a whole different story.
That's another story, is right. So
same guideline.
Yep,
I mean,
the chin tucks, seated or laying, then
Yep.
go to the towels with one of these options. And the other option, Bob?
Well, side bending?
Yes, right. So this is not as common, but Bob's had patients specifically as well as himself.
Me, yes. Yeah. This is the one I need to do because I'll do these all day long and my neck is still hurting. I don't get it too far down the arm, but it'll go down to the trapezius, you know, to there. And so what I do is I do the chin tuck and then I side bend to the painful side.
Right.
So, and Brad, what he's mentioned is I had this dentist who was he was getting pain all the way down the arm.
Yeah.
And when he worked on patients, would turn his head this way.
Just a habitual posture.
Yeah, a habit posture. And so what we had him do, the pain was going down this arm, he'd chin tuck and go to this side. Chin tuck and go to this side.
Mm-hmm.
And it just works wonders with me because when I'm working at a desk, I tend to go like this.
Yeah.
And so
that's the Forrest Gump posture.
Yep, that's right. Forrest Gump at the end of the movie where he and his child.
If you watch the movie, you know what I'm talking about.
So chin tuck, go to the right, or chin tuck, go to left if the pain's on the left side.
Right.
And you're looking for the same things. Is it improving the pain? You know, distally, I guess.
It's the yellow tape coming off.
Yeah, the yellow tape coming off. Try some of these, and you could be amazed at 80% of you should be amazed at how it helps. And if it doesn't, then I would seek out a Mckenzie trained therapist. Go to their website, Mckenzie MDT, McKenzie MDT.org.
Right.
And you'll they have a therapist locator.
Right.
They'll if there's a therapist in your area with this ability, they'll help you find it.
Sure.
So
very good.
Remember, Brad and I can fix just about anything
except for
a broken heart.
But we're working on it, Bob. We're working.
All right, we'll do it.